Obesity and increased cancer risks are shown to be linked. I sat down with St. Elizabeth Weight Management Dr. Schumann and Dr. Smith to explain how one affects the other and how they're working to keep people healthy. Dr. Schumann, there was a recent study that came out, and it was talking about the correlation between obesity and breast cancer in women. Expand on that and tell me why that is.
Well, recently there was a 67,000 women panel that they did a study that showed a 58% increase in obesity and postmenopausal breast cancer. They're not really sure of the correlation, but with the theories that they're having is that the increase in estrogen production by fat cells will stimulate postmenopausal estrogen-positive, progesterone-positive cancer. And that is one of the theories. The other theories are going to be that fat cells produce inflammatory cells or inflammatory substances, and insulin resistance all play a role. They're not really sure exactly, but they think these all are playing a part.
You deal with patients every day who are obese, overweight. The concern for you when you're talking to these patients, especially women over the age of 50?
Well, we want to let them know that there's more to it than just looking good. We want to make sure that they're dealing with trying to get healthy. And healthy doesn't always mean skinny. So when we do this, we want to go over what all risks are involved with their weight. And then we assess that risk and be able to determine what is the right pathway to take them down for their weight loss, whether it be medical, through behavior modifications, using things like supplements or medications, or surgical with Dr. Smith.
When you do these surgeries, Dr. Smith, and you're working to get these people to a weight that's not only more comfortable but obviously healthier, what is their biggest concern, and yours as well?
We want to have safe surgery for sure. And the biggest concern is, as Dr. Schumann said, it's not so much a cosmetic issue as the fact that being at a BMI of 40 or 100 pounds over ideal body weight puts you roughly at 4 times the risk of mortality on any given day. So ideal body weight's a concept that came up in the 1950s with the life insurance companies, and so that risk crosses many diseases. Cancer is certainly one of them, and besides breast, ovarian cancer, cervical cancer, uterine cancer, colon cancer, prostate cancer, etc. So what we're concerned about is improving the patient's overall quality of health and safety.
What do you see after a surgery has been done, the weight loss begins? What do you see within a month?
It's not uncommon for our patients to lose 30 pounds the first month. We put them on a liquid diet before surgery to try to make their liver a little bit smaller and make the surgery safer. And then they'll typically lose 10 to 15 pounds then, and then, like I say, within a month, probably as much as 30 pounds. The other major thing we see is a significant decrease in insulin resistance. So for our diabetic patients, they often will be off of all of their insulin medications, or diabetic medications may be more likely if they're oral hypoglycemic agents, within a matter of a few weeks. Insulin resistance drops within a couple of weeks.
You know, a big concern that people have is, I don't want to get breast cancer. My mom had it or my friend had it. We all know someone. And you hear this kind of study, it's alarming.
It is concerning. We look at it now, we cannot affect our genetics or our family history. But we do know that through diet and exercise, it's a modifiable risk factor. That's what makes it so important that everybody really know what the risks are and what can we do to modify it.
What would you suggest to someone who's watching today? What would you suggest as far as taking that first step on the road to a healthier weight?
Well, I think the first step is exercise every day if you can, to some extent. And we talk to our patients about that as part of the kind of multidisciplinary program we have here. And, we count, you can go for a walk, you can do some gardening, you can mow your lawn, whatever, but you have to get off of the couch and do something. And so there's, again, a lot of studies, a little bit different topic, but for, mental function and so forth. So first step is make the first step.
Literally. Dr. Schumann, Dr. Smith, thank you very much for coming on. We appreciate it.
Thank you. Appreciate it.
Thanks.
And we would like to thank our Think Pink sponsors, St. Elizabeth Hospital and King's Chrysler Jeep Dodge Ram Superstores in the King's Auto Mall. We appreciate your time and your sponsorship. All this